Hi, my name is Destiny Thurmer. I am performing my newborn assessment video following my general principles and safety practices. I'm going to start by performing hand hygiene and putting on clean gloves. And then once I have my gloves on, I am going to start out by turning the baby on the side and getting my bulb syringe to suction the mouth first and then suction both nostrils. Okay, now I am going to vigorously dry the baby to stimulate crying. Okay, pick up the baby, change the linen, and turn on the warmer. Now I'm going to start with the APGAR scoring. I'm going to listen to the apical pulse for 1 whole minute. I would do that at 1 minute and at 5 minutes. Alrighty, and I am observing the baby's respiratory effort. It is good. I am looking at the color. The baby is pink. The fingers and toes are bluish. I am checking the muscle tone, and the baby has a good muscle tone. Now I'm going to gently rub and gently flick the foot, check the reflexes. That is good. Now I am assessing the umbilical cord, and it is clamped. It is not bleeding. There is 3 vessels, 2 arteries, and 1 vein. Now I am going to do the baby's vitals. I am going to do the blood pressure at 24 hours after the baby's been born. With an appropriate size cuff, I would put this on the baby's arm. I would also have one on the baby's opposite leg. Alrighty. I am going to listen to the baby again. For 1 whole minute. Okay, the heart rate is good and the respirations are good. I'm gonna check the baby's temperature, its axillary temperature. Okay, and that is 98.6. Now I am going to put an identification bracelet on the baby. It's got one on the arm and on the leg, and I would put one on the mother, and I would make sure that they match. Ready? They do. I am going to do footprints before separating the baby from the mother. Ready? Now that I have done that, I am going to sit the baby up, and I am assessing the head for molding. I am looking at the front, or the anterior and posterior fontanelles, and they are soft and flat. I am doing a head to toe assessment on the baby. So just examining the baby, it has 2 arms, 2 legs, 2 eyes, 1 nose, 1 mouth, 2 ears, all 10 toes and all 10 fingers. Now I am going to weigh the baby. I'm going to safely transport the baby over to the scale. I'm going to zero out the scale. I'm going to lay the baby on the scale. Since it's an open scale, I'm going to have my baby laying here with my hand over the baby. Alrighty, I would document that. Now I'm going to check the reflexes. So I'm going to gently rub my finger across the baby's cheek to check for rooting. I'm going to stick my finger in the baby's mouth to test for sucking in the baby's hand, and then I'm ready. That is all good. Now I am going to clean the baby's eyes. I would get 2 moistened cotton balls. I would start from the inner to outer part of the eye and discard that. Alrighty. And then I'm going to get the cream. I would pull down the eye in the conjunctional sac, inner to outer, inner to outer. Now that I'm done with that, I'm going to administer the vitamin K shot in the vascular lateralis. I would hold the baby's leg, clean it with an alcohol pad. I would open up my needle, administer the medication. I would engage the safety and put this in a sharps container. I would make sure the baby has a Band-Aid. Now I am going to put a hat on the baby and put a diaper on the baby. Okay, and then I would swaddle the baby. And since the baby's swaddled, I can turn off the warmer, and I would give the baby to the mother, making sure to check their wristbands and everything. I am going to remove my gloves, do hand hygiene, report and record, and then come back, evaluate mother and baby.